This is Dr. Anina Abraham from Advanced Retina Care. I'm going to talk about eye flu. Now, all of us know there are many people in town getting conjunctivitis. What are the do's and don'ts when you have a conjunctivitis? Now, first of all, let's come to the do's. If you see one morning that you have a red eye, you have irritation in your eyes, watering, and you're just not comfortable, you first of all need to go and see an ophthalmologist. The reason is because there are various reasons for this kind of redness and irritation. It can be anything. First of all, you need to diagnose that conjunctivitis. Second thing you need to do is start medication. Now, antibiotic drops are prescribed for someone who has conjunctivitis, and lots of tear substitutes, which are lubricants. This helps to keep the eye moist and you feel less irritation. It is also important to see the ophthalmologist to know if it is a severe form of conjunctivitis. Now, there is a type called hemorrhagic conjunctivitis, which is very, very severe. You even see bleeding spots all over the conjunctiva. So the grading of your conjunctivitis, how severe it is very important because the treatment will depend on that. Very severe cases will even require steroid eye drops. Now, what is the next thing you need to do? You don't need to isolate yourself just because you have a conjunctivitis. But do you need to wear dark glasses? Actually, no. You can wear any glass to prevent your hands from touching your eyes, to prevent contact. That is the reason why we wear glasses. It's not that you see someone and that person gets the conjunctivitis. Your wearing dark glasses is not going to prevent conjunctivitis from spreading. This eye flu, definitely, it has spread like anything in the community. But the reason is because of contact. Secretions from the eyes of patients is what contaminates the surroundings. So it is important to wash your hands frequently. What do? You wash your hands frequently with soap. You sterilize, you hand sanitize, okay? Now, what is also important is all the linen, all the clothing of patients who are infected with this eye flu should be washed separately using Dettol because these kind of secretions, when they are stuck on the clothing, on the towels, on the pillowcases, you can easily get contaminated. Anyone else who touches that can accidentally touch their eye, and that's how it spreads to the eye. Is it possible for you to get conjunctivitis when you have not met anybody else who has conjunctivitis? Yes, that is also possible because at the end of the day, it is a viral infection. If you have a viral infection, like in the form of a sore throat, a cold, you can also develop a conjunctivitis. Now, that is different. That does not spread like that through the community. What spreads through the community is when you touch infected or soiled linen. You easily get conjunctivitis, and that time you don't have a sore throat, you have just pink eyes. Now, what are the symptoms of conjunctivitis? You can have watering of eyes, you can have redness. Now, it can start with one eye, and then eventually the second eye also gets involved. And you sometimes have so much blurring of vision because there's so much discharge coming and blocking your vision. All you need to do is clean your eyes, wash your eyes nicely, and use a lubricating eye drop. Antibiotic drops are given mainly to prevent secondary infection. But yes, they do help. Now, we should not think that this conjunctivitis has started and I have started using the drops and I still have the problem. Now, it is most likely that your problem is not going to go for at least 2 weeks. But yes, you will get symptomatically better with time. It's not something you need to be scared of. It's not something you need to isolate yourself from the world for, because conjunctivitis will resolve on its own. It's a self-limiting disorder. It will go down. Even though it's called an eye flu and people are getting scared, it's spreading like COVID, there's nothing to worry about a conjunctivitis. All you need to do is keep your hands clean, Make sure it doesn't spread to other family members, because if it is spreading so rapidly, it's actually spreading in families. They are going and spreading it to their friends, and their friends are spreading it to their families. That is how it is spreading in the community. Is it really seasonal? Well, I wouldn't really call it seasonal, even though we see it most in this kind of weather. That's because people are more and more closer together, and there's more close contact at this time. Now, what don't you do? You should not touch. First of all, do not touch something which an infected patient has touched. And do not forget to wash your hands. The second thing is, people always tend to start off antibiotic drops if they find somebody in their family has conjunctivitis. Let me use antibiotics now itself so that I don't get the conjunctivitis. It doesn't work that way. Your prophylactic antibiotics are not going to help. Let's see, if you get conjunctivitis and if you need antibiotic drops, your ophthalmologist will tell you whether you need the drops or not. Some people have such mild infection, they really don't need any drops. But it is important for you to see your ophthalmologist to see how and what stage your disease has come to, and even if it is resolving. Sometimes there can be something called SPKs developing on the cornea. The cornea is the transparent layer in the outer portion of the eye, which we think is black in color, but actually it's transparent. What happens is sometimes small spots form on the cornea. That causes blurred vision. That is what we need to rule out. That's why we go to ophthalmologists for checkup if we have a severe conjunctivitis. And these cases are the ones which require steroid drops. So don't neglect your conjunctivitis. Yes, you do need a checkup, but at the same time, it is a self-limiting condition. You can contain it by preventing others from touching your secretions, and you also wash your hands regularly so that you don't contaminate other things with your infectious secretions. And let us hope that this is contained fast and this season of eye flu is gone forever.